Welcome back to the podcast, Real Life Pharmacology. Today I'm going to cover Bactrim or Septra. So this is a combination agent made up of trimethoprim and sulfamethoxazole. The mechanism of action here with this medication is ultimately it inhibits bacterial folic acid production. And we do have two different medications within this, and they essentially both do this with the kind of varying mechanism of actions there. So basically, I think for most purposes, most test purposes, I think inhibiting bacterial folic acid production is probably the best way to remember that mechanism of action there. So uses with this medication, oftentimes, probably most often, I'll see this used for urinary tract infections. I have seen it used for skin and soft tissue infections, like a cellulitis type situation. I may rarely see it used for upper respiratory tract issues. It is one of the drugs of choice in PCP prophylaxis in patients with HIV or immunocompromised states. So that's a good one to remember there, Bactrim for PCP prophylaxis in HIV. Definitely a testable question that I've seen before. Now, as far as side effects goes, with any antibiotic that we're using to treat gram-negative infections or whatever infections we're treating, GI symptoms can happen with just about all of them. So stomach upset, nausea, vomiting, diarrhea. We definitely need to pay attention to that. Most often with antibiotics, we try to encourage patients to push through those type of symptoms, take with food, do whatever we can to obviously continue that course of antibiotic, which is going to be necessary for managing an infection. Other maybe unique side effects to Bactrim specifically, you may see rash, and there are so many patients with a sulfa allergy or termed a sulfa allergy that may get that rash from this medication. So with that, you've got to remember that this is a dual medication. There are two medications within Bactrim. And we were actually burned on a case where a patient was labeled with a sulfa allergy, and the patient had reacted to Bactrim. So later on in life, this patient, we had tried them on Trimethoprim, and they reacted in an allergic type reaction. And odds are likely, even though this patient was labeled with a sulfa allergy following use of Bactrim, they likely were more reactive or had a reaction to the Trimethoprim, maybe by itself or maybe with sulfa. Maybe they reacted to both. It's hard to tell in that situation. But I do want to caution you that if you have a patient that reacts to Bactrim, there is two drugs in there. So you might just want to document that they had a reaction to Bactrim. That way, if trimethoprim is ever going to be used again, the next clinician, next provider, next pharmacist, whoever's helping work with that patient understands that and knows that it could have been from either agent. So definitely a word of caution there. I do have that case written out in the Thrill of the Case, my new book, so you can go check that out if you wish. But yeah, it was definitely one of those cases where we always generally associate sulfa allergy and maybe hives, rash, that type of thing to the sulfa component of Bactrim, and we don't really think about the trimethoprim component. So definitely one to remember there. A couple other rare adverse reactions you might see. You might see some confusion, some CNS changes, maybe fatigue. Again, not real common, I don't think, with Bactrim, but obviously something to be aware of if they start a new medication or start it to treat an infection and you see those changes. One other pearl I want to point out as far as adverse reactions go is this medication can contribute or cause kidney stones. So when we administer this medication, it is recommended to do this with a full glass of water, and the thought and the theory being that can help reduce our chances of developing the kidney stones from this medication. Now, I talk a lot in the podcast about really highly testable pharmacology pearls. At meded101.com, we've got great resources there to help you really prepare and pass board exams. Specifically for pharmacists, we've got NAPLEX content, BCPS, BCACP, geriatric certification prep, all sorts of different tools for you to use. And again, these are highly testable things that we focus on, well-known clinical pearls to really help distill down that information and help you best prepare to pass those exams. So hope you enjoy the podcast, reallifepharmacology.com, but MedEd 101, kind of our sister website, has great specific resources for some of those test prep materials. Let's finish up this podcast on drug interactions, and there are a few significant interactions I think you should be aware of. So the first one I have to talk about with Bactrim is warfarin. And Bactrim, what it does is it inhibits CYP2C9, and 2C9 is a major metabolic pathway for warfarin. So ultimately, by inhibiting this enzyme, it prevents the breakdown of warfarin and can lead to raised concentrations, which can lead to elevated INRs and obviously increase the risk of bleed. So checking an INR following initiation of Bactrim is really important in patients on warfarin. So in that 2 to 3 to 5 day range, we're probably going to want to check an INR. You can also educate your patient certainly to keep an eye out for any nosebleeds, blood in the stool, significant bruising that may be indicative of that INR rising up due to that drug interaction between Bactrim and warfarin. There is potential for trimethoprim, specifically as part of Bactrim there, to contribute to phenytoin toxicity. So trimethoprim can raise phenytoin levels, so that's an important one, I think, to remember if you've got a patient on that medication. One other thing trimethoprim can do is raise potassium levels. So if you've got a patient that's maybe borderline high, they've had a history of hyperkalemia, maybe they're on drugs that exacerbate hyperkalemia already. So let's say an ACE inhibitor, let's say spironolactone, which is an aldosterone antagonist. If you've got a patient on those drugs and at risk, or maybe a borderline high potassium level, that trimethoprim could shoot them up. And I definitely have seen that in clinical practice periodically. So take a look at what their med list says, what their past history says, and maybe we need to check a potassium level following initiation of the Bactrim or the trimethoprim component more specifically there. One other interaction I wanted to cover, it's always a good idea to monitor our patients who are on insulin and medications that stimulate insulin release, like sulfonylureas, for example. So it's always a good idea to watch those patients closely. And whenever you see an antibiotic started, odds are likely this patient's diet has changed anyway. They have an infection, they don't feel good, they're probably not eating maybe as much as they normally do. So that in itself is kind of a risk factor for hypoglycemia. But the medications itself, trimethoprim as part of Bactrim, can potentially increase that risk of hypoglycemia as well. I would say it's not a crazy strong association with hypoglycemia, but I think it is an important thing to remember, and maybe patients specifically at risk for hypoglycemia, that may give them another additional risk factor, and we should maybe monitor those folks a little bit more closely. But there again, remember the infection itself. If patients aren't eating well, and maybe they have some GI upset, some stomach concerns with that antibiotic, with Bactrim as well, that makes them not have as much intake. So kind of multiple factors can go into a situation where we've got hypoglycemia happening. So definitely encourage our diabetic patients on hypoglycemia type agents to really keep close tabs on those blood sugars. So I think that wraps up the episode for today. Again, check us out, that free giveaway, top 200 drugs, 31-page PDF, absolutely free at no cost to you. Simply get it for following the podcast. I really share updates on when I've got a new podcast out, a new drug that I'm covering. Really try not to spam you much at all, but certainly go sign up, grab that free download. I've also got a 100-question pharmacology quiz as well, as far as that, as part of that free download. So really no cost to you other than simply an email there. So reallifepharmacology.com. Thanks for listening. If you love the show, leave us a rating and review on iTunes. Greatly, greatly appreciated. So again, reallifepharmacology.com. Check us out. Take care. Have a great day, and thanks for listening.